Yes, hello everyone. Welcome to this channel, Health Diary. On this channel, we share about various health topics, depending on the common challenges in our world today. Yeah, and we just hope that everyone can take on a healthy lifestyle, so that you're able to live healthier, not just longer but also healthier. Yeah, we don't want you catching various illnesses which are avoidable, and if possible we don't want premature deaths. Yeah, want to point out those things that can help us live a better health lifestyle, such that we have longer, healthier lives. Yeah, so that's basically what we talk about. And in today's episode, I want us to see um, something to do with cholesterol. How do we maintain normal blood cholesterol levels? I don't know if everyone knows about what we mean by cholesterol, but what I'm trying to mean is, you see, our blood, yeah, carries a lot of things, hormones, uh, all these food components that we eat, a lot of things, and cholesterol is one of them. Cholesterol is a blood component, in other words, and usually this one is got from food. Yeah, we from elementary school, most of us learned about proteins, carbohydrates, fats, vitamins. So cholesterol, what used to be called fats, when it goes into the body, usually we term it as cholesterol is the other term, yeah, to mean fats, yeah, or lipids, yeah. So usually they move in our bodies, and just like anything, they can either be good or bad, depending on the levels, yeah, the levels at which they are in blood. Some of the good things about it is that it helps us with energy. It works with carbohydrates to give us energy. It's these fats that get deposited in various parts of our bodies, like below the skin, and they give us some bit of insulation, all these things. A lot of importances, those are some of them. However, on the other end, we are noticing a trend where most of us live with excess cholesterol in our blood that is starting to affect life or shorten life. Yeah, for example, we've seen cases where someone, because of the unmonitored, unregulated cholesterol in blood, you end up with, this cholesterol, usually when it's excess, it's the major target it has. It damages our vessels. Yeah, it damages those pipes that help us transport our blood to and fro. Yeah, so usually when it damages those, usually how it damages them, it blocks them. Yeah, it causes blockages. So that if you've seen cases of stroke, yeah, it's because the vessel that was going to the brain was blocked by this excess cholesterol. Yeah, all events start from the cholesterol. So it was blocked, and now blood can no longer reach the brain. That's how someone ends up with stroke. Yeah, if you've seen cases of heart attacks, it's because the excess cholesterol, or the bad cholesterol, which I will point out, went damaged the vessel to the heart, and now the blood can't reach the heart itself. The heart starts dying off, and that's how people get heart attacks and sudden deaths. We've seen people have kidney disease because the vessels to the kidney have been blocked. Blood can't reach kidneys, and it's the blood that nourishes all these different parts of our bodies. So that's why I found it important that we look at it and see, how do we actually keep it in check? How do we keep cholesterol in check? Yeah. So what exactly can we do to maintain normal blood cholesterol? The starting point would be, and I will borrow this from the American Heart Association. Usually it recommends that for everyone above 20 years, yeah, it's recommended that you start checking your blood lipid profile. That test is called the lipid profile. Yeah, for everyone above 20 years, it's good to start checking for it. Okay, and they are recommending 20, but for me, I would think, if you come from a family where people get sudden, like they suffer from those heart diseases at a very young age, it's actually communicating to something. For example, in their 30s, some diseases are expected to come in later as we advance in age. But if you come from a family where people get heart disease in their 20s, in their 30s, I would think at any age, it would be good if you checked it out, because it's of no harm. It's just a matter of getting a part of your blood and running it into, doing those tests and giving you results. It's nothing so big to worry about. So yeah, that's about checking. So it's good today, maybe you decide, go check. What's my stand as per today? Because that's where we shall start from. That's where we shall know. If there are normal ranges, yeah, it's advisable to repeat every 5 years. Yeah, every 5 years. Then if it's abnormal, usually there's some protocols we use to inform you if you're maybe at risk of heart disease, if you're already having heart disease, and different interventions come in. Yeah. So the first step is checking for your blood levels, or doing that lipid profile and checking where you stand as per today. Yeah. Then the next step would be if you are to maintain normal. So if we found you have normal blood cholesterol according to the tests, what is the way forward to make sure that they remain normal? Because yeah, we need to put intention. Otherwise, they can be normal today, and then the following year they are normal, depending on what you're eating and your lifestyle. Yeah. So the next thing we'll do is, there are various, of course, recommendations that have been given. Some people will tell you that stop eating fats, but I disagree with that, because when you stop eating fats, at the end of the day, we need energy. That will mean that you resort to only carbohydrates, of which even carbohydrates eaten in excess will give you diabetes. So at the end of the day, most of the even the research that has been done disagrees with that approach. Rather, we have something we call the Mediterranean diet. I'll tell you about it. Usually, for it, it's recommended that fats are okay to eat. Yeah, it's okay to have like 30% of your diet made of fats, as long as we eliminate or reduce saturated fats and trans fats, because those are the biggest contributors of the bad cholesterol, or LDL, you get. So it's good to eliminate. So you have to check out in your, like, of course, different environments have different diets to them. Yeah. So you have to check, in my environment, what are the saturated fats, yeah, that we have. But of course, some of them, the common ones, we have full fat dairy products, things like butter, ghee, full fat milk, cream, all those things. Then you have things like processed or fried snacks. So these are sources of saturated fats. So it's advisable that you reduce that to as little as you can. Yeah. Then eliminate all trans fats. Yeah. Eliminate trans fats from your diet. So you'll find that, and it has been discovered, when you do that, yeah, of course, in addition to carbohydrates, when you do that, lowering, like eating the saturated fats as less times as possible, and then eliminating trans fats from your diet, it's been discovered that the outcomes are almost similar to someone who has used medication to lower their fats. So that shows you how effective it can be. Yeah, not all fats are bad. Rather, saturated fats and trans fats are usually the cause of the bad cholesterol that injures our vessels. So that's the first thing. Check out in your environment, what are those saturated fats at your disposal. Limit them as much as possible. And what are those trans fats exposed to you, eliminate them from your diet, and then you continue with your lifestyle as normal. In that way, you shall have a normal cholesterol. Then also the other thing is, of course, there are some other foods, fibers, soluble fibers, that are found to also give an additional advantage. Yeah. Then there are also other things other than diet, where they encourage, if you're overweight, it's encouraged you lose some weight. Yeah, you lose some weight.